everyone, and welcome back to Open. I'm Rhina Valentin, your host, Café con Leche, for the next hour, encouraging you to get social with us online. That is, tweet us and follow us on Instagram at BronxNet TV and like us on Facebook at Open BronxNet Television. Of course, you can always follow me on Twitter, FB, Instagram, Insta Stories, and LinkedIn at Rhina Valentin. So, as the Delta variant continues to surge across New York City and the United States for that matter, many people are still left with questions about the latest COVID strain. And according to the CDC, the Delta variant is twice as more contagious and may cause severe illness for unvaccinated individuals. And joining us to tell us more about the Delta variant and also if a booster shot is needed, we welcome Union Community Health Center Medical Chief Officer, Dr. Jae Ahn. Hello, Dr. Jae Ahn.
Good morning. Nice
Good
to
morning.
be here, Rhina.
Nice to have you with us. Well, welcome. And I guess it's pretty much a time for you to start revving up again. I mean, I thought we were on the other side, and here we are preparing for another preventative matter. So, Dr. Ahn, first, I want to thank you for your service, being in the front lines, and also for working directly within our community at Union Community Health Center. What can you share with us about the Delta variant that will allow us to have a better understanding of this new strain versus COVID-19?
Yeah, so the coronavirus can mutate or change over time. So different version can develop, which may be more transmissible, creating more disease and actually more hospitalization and even death. So in order for us to protect ourselves from the Delta variant, we have to vaccinate ourselves so it decreases the potential to get very sick. Now, when you get vaccinated, it doesn't mean that you don't get sick. You just get a milder form, maybe asymptomatic, and you definitely avoid hospitalization and potentially death. So that's why we're encouraging vaccination. Yes, you're absolutely right. July was a hiatus. We kind of got a break. The Delta variant wasn't here really. We felt good about our vaccination rates across the country. We were opening up, and if you were vaccinated, you didn't have to wear masks as per the CDC. But now, because of this surge, it was sort of unexpected that it's taken over very rapidly in the last few weeks. The CDC again recommended masking and indoors to protect everybody from infection.
So is the Delta variant more deadlier than the regular strain of COVID-19?
Yeah, the data is coming in and it's evolving. It appears that it's definitely more transmissible and may cause more illness and more severe illness, leading to more hospitalization and actually more death. So that's what we're seeing in the US, especially in the unvaccinated group. They make up the majority of hospitalizations and deaths across the US right now. So it's very important that everybody gets vaccinated. In New York, our positivity rate is not as high as in the South. We're still hovering around 3.5% to 4% in New York City. So, you know, that's much better than
Right.
South. So
Is that because we have a higher vaccination rate?
Yeah, we do have a higher vaccination rate with adults. We're almost at 60% fully vaccinated in New York State, which is very good. Across the country, it's about 50% fully vaccinated. So we're not at the herd immunity level of 70% or more, which is what we would like. So what's happening is that the CDC got very concerned that they thought that vaccinated people weren't able to transmit the virus to unvaccinated, vulnerable people, and now they've discovered they actually can transmit the virus. So this is why it's very concerning, because those vulnerable, unvaccinated people are now at risk of getting very sick, whereas the vaccinated might get sick, but they might get mild or asymptomatic illness, which protects them. But if they have any vulnerable people in their family, the grandparents, young people, less than 12 years old, I mean, they could potentially get very sick. So
right, for clarity purposes, right? Because here, just so that we're clearing it up to our audience. So
yes,
people vaccinated and we're going to say what everybody thought, okay, we're vaccinated now, we can't get it. Yes, we could still get it. It minimizes the symptoms in contracting it. However, in getting it and maybe not even knowing you have it, you become asymptomatic and you can pass it on to someone who may not be vaccinated and or somebody who's vaccinated. The difference is that it's going to have a different reaction. Each individual is going to have a different reaction, right? So,
That's correct.
right. So that's one clarification. Now, this new, I guess, suggestion of children from 12 and up, that's another concern, right? Because as a young, they're not even adults yet, they're not even teens yet, their body is still developing. So I think we're missing clarification on the impact the vaccination has on the body. Just to say from a child who's growing, like, why is it that kids that are younger than 12 can't get it, but yeah, 12 can, and when at 12 years old, they're still growing?
Well, mainly it's because when the vaccination safety and efficacy was rolled out, it wasn't really tested in younger individuals less than 12 years old. So we really can't say how safe it is. Right now, the safety trials are happening right now, the phase 3 trials for Pfizer and Moderna. So once that trial is complete in the next month or two, we will have more data and be able to safely say that less than 12-year-olds we could give the vaccine to. As to your question about older, young adolescent people, maybe you don't know enough about their bodies and about its safety, I would say it's shown to be safe in adolescent too. I mean, that's why they basically approved it.
Got it. And so where we are now in just obviously we have a freedom of choice somewhat. Now there's this requirement to be vaccinated, and now there's this, requirement of showing that you're vaccinated if you go to a restaurant or you're at a gym or, these indoor gatherings. What do you say to people who are feeling as if though their freedom is being challenged?
Yeah, we're not trying to curb someone's activities, but we want them to have that activity safely and not be a super spreader event. So that's the concern. And I think it's very prudent to ask for vaccinations in large gatherings because unfortunately, once in a large gathering, you could have a huge spread of virus inadvertently and really have horrible consequences for that event. So I think it's reasonable to ask for vaccinations, especially in any gathering that's more than 10 people. That's not really a good thing.
And so now,
yeah,
no, right. And so now, being vaccinated and still having to wear a mask in an indoor environment with other vaccinated people, like when is the mask wearing going to be over?
One thing I understand people are not happy with the masking, but I'm not asking them to wear a handcuff. I'm asking them to wear a mask to basically capture their secretions. And then so that if they inadvertently have it and they don't have any symptoms, they don't even know that they're sick. And that mask is a protection for other people, as well as for the person wearing it. You will hopefully not get exposed because you're wearing the mask. I understand people are definitely, annoyed by wearing a mask, but I would say still it's an inconvenience that I'm willing to take. And I think most people want to take it, especially if you've had any family members really sick or hospitalized or even died from it. You would feel bad that you never wore a mask. I mean, just imagine your family loved one got sick and even died, and then you could have said, well, I should have worn that mask. I mean, do you really want to have that thought? Do you really want to sit there at home and be upset with yourself because you got your grandmother, mother, or some vulnerable person that you live with very sick and you can't take this stuff back? This is it, and this is a lot of times when you see on the internet of stories of people, especially in the South, they were against masks and they regret it. They regret not wearing a mask. They regret not vaccinating. And I don't want to have those conversations with my patients. I don't want to have those conversations and saying that, well, it's sort of too late to give you the vaccine because you're admitted in the hospital and ICU. I mean, this is the conversations people in healthcare are having right now. Sorry.
It's okay. I think you made your point, and I think we all got it. And all I can say is, guys, you heard it from the doctor herself. This is Dr. Jae Ahn, who's the Chief Medical Officer at Union Community Health Center, and they are offering free walk-in vaccination shots. And we just had a whole discussion on where we're heading if we don't address the situation now before flu season comes in. So thank you for being with us, Dr. Jae Ahn. And you guys, for a vaccination near you, you can visit vaccinefinder.nyc.gov. And also, like I mentioned, the Union Community Health Center is accepting walk-ins for vaccination shots. And for more information on the Delta variant, you can visit the CDC. All right, we have to take a quick break, but when we return, we're going to hear about a new project celebrating salsa. Don't go anywhere.